I had SDR done for comfort and pain relief and not for the ability to walk. The day I had my stitches out, they told me to be there for 12 o'clock, so to make sure I was there on time I was even a little bit early. They have to pay J surgeon because Mr. Ferrer doesn't like anybody else taking the stitches out apart from his team of people. So I waited for an hour, and then when the nurse came past and she said, I will pay J surgeon again to come and check the wound and take your stitches out. This went on for a total of 6 hours. The nurses paging the surgeons and ringing their secretary. They were very embarrassed we had to wait so long. Then after 6 hours of waiting they finally got hold of Mr. Ferrer's registrars, who took me into one of the treatment rooms. Mum asked me whether I would be able to lean forward enough to get the stitches out. I tried, but he said that it would be a little tricky to get them out. He would be able to do it. We decided otherwise and just got on the bed. We asked him whether it would be easier to have me sat up or lay on my side. He said I'm not bothered, so we decided that laying on my side would probably be easier. He then said a little bit of a pull while he was taking them out. It stung a little bit. Also, it had become buried in my skin a little bit. It has now been 4 months since my operation. My scar is now fully healed and my pins and needles have now gone all together. I was being reviewed again in clinic in February by Mr. Ferrer and his team. I have got a new seat cushion and backrest. It is called a V-Track. The seat is called Bitus. I got a new electric wheelchair. It's called a TDX Lowrider. I went for my first appointment after my operation. Mr. Ferrer said my scar was healing very well and he was quite happy with the results. James had a look how much movement and spasticity was left in my legs, because I had said to them there is more than I thought in my right leg, so he checked it and yes, there is a little bit more on my right side. We discussed the options and there is nothing more they can do surgically. They talked about buttocks, but that would cause me more issues in my hamstrings. They wanted to see me in 6 months. I went to my consultant Dr. O.O. on Friday 13th of April 2018, who hadn't seen me since before my surgery, and she was very pleased with the outcome, but I do need buttocks in my right hamstring just to make it a little less tight. I am going to have it done. I went for my buttocks done on Friday 25th of May. By Dr. O.O. She did an amazing job because I am needle phobic. She put emblem on it so that I wouldn't feel it as much as I would without it. I am not saying I didn't feel any of it because I did, but I'm saying it took most of it away. It only took 2 days for me to notice a difference, and it was only day 1 of the 2 days and I was already started noticing a difference, but it shouldn't stop me being able to do whatever I want to do. I do not know why my right knee hurts, but after having buttocks and her saying to me this will work for at least 4 months or it may not even work, I think it has worked up to a point, but then it stopped. I have to cross my legs to stop it from hurting. It's mainly my right leg, but we will see why soon, I hope. I am not saying it is as bad as it was because it's not, but it still hurts. It's like a nagging ache unless I cross my legs. I went to the clinic on Friday 24th of August to have a neurological physio assessment to see whether they can help work out why my body does what it does and see if they can advise on my seating. I went to see Mr. Ferrer for the yearly appointment after my surgery. They were very pleased with me. They are going to write a letter to back up the application about having a neurological physio assessment. It went very well though. They said I also had something called dystonia. Dystonia is a neurological movement disorder, faulty signals from the brain causing muscles to spasm and pulls on the body incorrectly. This forces the body into twisting, repetitive movements or abnormal postures. Sometimes the symptoms are accompanied by dystonic tremors. I went to see orthotics. They are making me 3D insoles even though it is only 1 foot that needs it. They are doing me a blank one because I have dystonia and they wanted to put a blank insole in the other foot so it doesn't kick my dystonia off. I am getting them on the 16th of December. They said it would take quite a while for me to get used to them because it's supposed to support my foot so that it doesn't turn in. I have had my new insoles now for 4 months and they are working amazingly. They have stopped my foot from turning in. I have had no problems with them at all. Sometimes I don't even remember that I have got them in, which is what we wanted. The other one that I've had put in as a blank insole for the other foot so that it wouldn't cause me any problems with my dystonia. It has been working. See. Other. Video. About. See other video about them. As a consequence of being looked at closer regarding my postural seating, it was decided that I would need an assessment by a neurophysio, so they applied to the CCG, who are responsible for health funding. The application for the assessment funding was a success. I had to have 2 sessions with 2 neurophysiotherapists. Now they have done a full report to send to the CCG with costings on. We now have to wait to see if the CCG will agree to the funding. On the 20th of September 2019, I went to the Walton Centre for my 2-year review since my surgery. James was very pleased with me. He explained to me that I would never get rid of my startle reflex I have got. He also talked about there being medication that could help with my dystonia. We are going to look into them. He talked about there being an operation they could do called deep brain stimulation, also known as DBS. I am going to try neurophysio and medication first, but I need a bone density test to ensure it is safe for me to wait there. He is going to arrange it for me and write to Dr. OO about the medications. I am very happy to say my funding has been agreed by the CCG for 40 physio sessions. I went for my first physio session on Wednesday, 16th of October 2019. It went well. I managed to do things that I tried in the 3 days trial that I had before. I'm going back on Friday for another session of physio. When I got home, there was a letter from the Walton Centre had sent to my GP, which was to ask for him to sort out a DEXA scan to just check my bone density before the physio will let me do any weight bearing activities. They are letting me do st and transfer standing because that is just a quick movement and I'm not on my feet for long periods of time until I have my DEXA scan. They only want me to have one of these because I haven't stood for a very long time. I went on Friday the 18th of October 2019 for another physio session and they worked with me to try and stabilize my core. They also worked on trying to stop my muscles joining in when I do a movement with another part of my body, e.g. move my arm and my leg comes with it. On Wednesday the 4th of December 2019, I went for my DEXA scan done. I took my ear defenders and ear plugs because we was not sure what would be better for me to have. Mum had taken me on time so I wouldn't get too nervous whilst waiting. So when we got upstairs and went to go into the waiting room, the radiologist came. They allowed me to wear my ear defenders because they didn't have any metal in them. Mum got me onto the bed and within 10 minutes I was done and heading out. Mum and I said that was the quickest appointment we have ever had. We liked it though. On Wednesday the 11th of December 2019, I got my DEXA scan results. It was not good. I have osteoporosis in my spine and hips and pre-osteoporosis in my femur. They are going to put me on vitamin D and calcium straight away. I will have to wait to see my consultant to see whether there is anything else they want to do with me.
Hello everyone, it has been a while since I updated you all. Because there hasn't been much for me to update you on, I thought I would use Communicator 5. So here we go. I had a phone consultation with my specialist about my osteoporosis on the 27th of May 2020. Overall it was a great appointment. They don't actually call it osteoporosis in people under 40, they actually call it reduced bone mass. He said that because I can't walk, he was not surprised about the readings. They were lower than they should have been though. It was normal for people like me to have lower bone density because I haven't walked. Weight bearing and load bearing both help with bone health. He said if I fell I would be more at risk of breaking something. He wants me to have a blood test to check my vitamin D levels because sometimes they can be low, and he wants me to have some other blood tests done. Also, I will have to go for a DEXA scan every 2 years to just check everything is okay. He was happy for me to carry on with the lifestyle I have, as being active helps my bone health, although I will have to weigh up the risks if I wanted to take up anything new. Thank you for watching.